Hi, Dr. Schendel.
Hi, how are you?
Welcome to In Good Health.
Thank you.
We're happy to have you today.
Thank you very much. I'm happy to be here.
Thank you. So, Dr. Schendel, you're a pulmonologist. Will you tell us what that is?
Yes, I am a lung specialist, so I take care of people with diseases of the lungs such as asthma, COPD, and emphysema.
Okay. And is one of those ailments more prominent than the others?
We do have a large population of patients who have lung disease. Smoking has contributed to our population of patients with COPD and emphysema.
Okay.
And then
so they all kind of go together?
Yes.
Do you only get lung disease when you're a smoker, or are there other ways to contract a lung disease?
Smoking is one of the ways, probably one of the most common reasons people get lung disease, but there are other exposures that people may have in their homes or in their businesses, places
Exposures
of employment.
in what way?
Things that they may do at work, dusts, gases, fumes that they could be exposed to. Okay. And then some people have lung disease for not any particular reason, just something that they are having to deal with.
Is it a genetic dynamic, or can a person be predisposed because of their genetics?
Yes, definitely some diseases run in the family,
Okay.
some of which we don't know all the details about, but there are familial lung diseases as well.
Okay. And how would someone know to come in and have their lungs checked? Like, what are some of the symptoms or signs that would alert someone to go in for a checkup?
Most commonly, shortness of breath. Sometimes when they're just resting, sometimes they'll notice it when they're starting to exercise or do other activities. Also, things such as cough, any noises they may make when they breathe, such as wheezing, would be indications to come and see a lung doctor. Okay.
And is it difficult to test the lungs?
Not really. There's a couple pretty simple tests that we do actually right in the office to give us at least a starting point as to what might be going on.
And so will you tell us what does a lung screening look like?
So lung cancer screening, something fairly new that we've started, similar to what we do for breast cancer screening or colon cancer screening, is a CAT scan of the chest. So it would be pictures of the chest. You would lay on a table and the radiologist would take pictures of the chest to look to see if there are any small spots in the lung.
Okay. So who's a good candidate for lung screening?
So we do have good criteria for people who are at high risk for having lung cancer. Anyone between the ages of 55 and 74 who've smoked for 30 years, about a pack a day, and are either still smoking or have quit within the last 15 years would qualify under Medicare for free lung cancer screening.
Oh, okay.
Now that's just
even without symptoms?
Correct.
Just because of
because of risk factors.
Nice.
And that's a screening examination. From there, depending on what is found, other testing may be necessary to work up anything that we find on the CAT scan.
Okay. And if there are small spots, should a person become immediately alarmed, or would follow-up tests let them know if it's something serious or not so serious?
Right. So sure, anytime you hear that, it's concerning. Most of the time, we actually do find spots in the lungs, and most of the time, they're nothing to worry about. Okay. Depending on what they look like, the size, patients, risk factors, we would determine if something needed to be done, such as a biopsy right away, or if it's something that we could just follow.
Okay. And how does a person maintain healthy lungs? Like, what are good best practices for, keeping your lungs healthy?
Number one is not to smoke. That's the biggest thing. I think we all know that. It's a difficult habit to quit, but that's the number one thing. And protecting yourself from any other irritants in the air. If you know you're exposed to other forms of smoke, something else in the workplace, using protective equipment from that. And then other than that, just, healthy eating, exercise, good sleep all help the lungs and the rest of your body.
Okay. And then if you are a smoker, I know, like we mentioned, it's a difficult thing to break. What kind of things should they be mindful of? Still exercising and sleeping and those things as well?
Still all important. Okay. But trying to quit smoking and finding the best way for each individual is very important to me and other lung physicians and other physicians in general. We have lots of options that we can use, support groups, medications, other kind of feedback mechanisms to help people quit. So looking into those options and seeing what works for each individual is really important.
Are the lungs the only thing that a pulmonologist would focus on in terms of good health?
The lungs are a big part of what we do. The heart and lungs work together, so we are often focused on some of the mechanisms of the heart and work closely with the heart specialists or cardiologists for that.
Okay. And how does lung cancer differ from COPD or asthma?
So lung cancer may occur in a patient with COPD or asthma, or may occur in somebody who has no other history of lung disease, or even those who don't smoke.
Okay.
So the treatments for that is quite different. When we say patients with COPD or asthma, they're similar lung diseases in that patients have difficulty in breathing and difficulty exhaling or letting out all their breath.
Okay.
Those are usually treated with inhalers and breathing treatments.
So how would someone develop COPD and asthma?
With regards to COPD, smoking is the number one cause.
Okay.
Other smoke exposure in the workplace or at home can sometimes lead to COPD.
Secondary smoke?
Yes, it can.
Or secondhand smoke?
Secondhand smoke,
Okay.
whether it be from cigarette smoke or those people who may work in professions where smoke, whether cooking, firefighters,
Okay.
less common, but it can happen. And those patients are typically older because it does take some exposure and some time to that exposure to develop COPD.
Okay, and what about asthma?
Asthma can occur in any age group. We see it in small children, and we see people develop it even in older age that haven't had a history of it.
And what are the risk factors for developing asthma?
Those are a little bit harder to determine. A lot of that probably is genetics. Some of that is contributed to with allergens that people may develop. There's a common link between allergies and asthma. And as I said, that can happen at any stage in life.
Okay. How difficult is the treatment plan for asthma and COPD?
The treatment primarily for those diseases are inhaler therapy. There are lots of inhalers that patients can be prescribed. And when we do prescribe those, we go into a lot of detail about what they're doing and how to use the inhalers, and in hopes of getting good control of patients' breathing.
Okay, and I've also heard about steroids helping with, increasing the lung capacity. Is that truly the case?
Steroids do help. They're a powerful anti-inflammatory.
Okay.
They come in inhaler form, and it often is a first-line treatment, especially for asthma.
Okay.
Steroid pills are also used in some patients who have flares of their lung disease and need some more anti-inflammatory medications in an acute setting.
Okay. So inflammation is at the root of lung disease? Or?
It is definitely part of it, yes.
Okay. All right, well, thank you so much for joining us. That was really great information.
Thank you.
We appreciate it. Take care.
To learn more about lung cancer screenings, visit mclaren.org/Macomb Imaging.